The three most prominent diseases in the Civil War were dysentery, typhus, and typhoid disease. Bacteria was spread easily from person to person in the Civil War because of poor sanitation, doctors not washing their hands from patient to patient, and drinking low-quality water. During the Civil War, medical procedures took leaps, starting with amputations. Before amputations, doctors, quote, cleaned wounds with cleaning rats and maggots.
Amputations were clean cuts just above the knee to avoid joints.
The first antibiotic discovered was penicillin, which was actually discovered by accident from a man named Alexander Fleming, who left his petri dishes when he went on vacation and came back to discover some odd things. Penicillin is used to treat gram-positive infections like ear infections, saving a lot of lives because back then people died from things like ear infections, when now you can just go to the doctor and get an antibiotic and you're pretty much set to go. Penicillin sparked the discovery of many other antibiotics, including streptomycin, which treats TB, and erythromycin, which treats bronchitis. Hand hygiene is something that seems so common sense now. You wash your hands before you eat, after you touch something dirty, after you pet your dog, etc. But back then, hand washing wasn't really something that was so well known.
To wash your hands, first turn on the faucet with a clean paper towel. Then use the towel to get some hand soap. Work the soap into a rich lather, washing all the way up to the wrist. Rinse both hands thoroughly. Then take a fresh paper towel and turn off the faucet with the paper towel. Then throw the paper towel away, and you're done.
A doctor named Dr. Semmelweis actually discovered that patients were getting fatal infections spread from patient to patient from doctors not washing their hands in between visiting patients. He immediately made a set of rules. After an autopsy, a doctor had to wash his hands with a mixture of lime and chloride, and after an exam, a doctor had to wash his hands with a mix of soap and water.
Good bacteria is called a probiotic and are like the bacteria that is already in your body. Probiotics are present in yogurt and dietary supplements. Some good bacteria are Lactobacillus, Bifidobacterium, and Bacillus coagulans. We can't live without good bacteria because it already resides in our bodies. Antibiotic resistance is when an antibiotic can no longer kill a bacteria because of built-up resistance that the bacteria gets for the antibiotic. Antibiotic resistance should be feared in the case that there is a dangerous bacteria in your body that has built immunity towards the medicine that removes it, as that bacteria will keep multiplying. Bacteria becomes antibiotic resistant not only naturally, but because of misuse of antibiotics, a genetic mutation, or bioresistance that was picked up by a different bacteria. The bacteria that is antibiotic resistant gets multiplied, which gets very difficult to contain after just a portion is antibiotic resistant. Antibiotic resistance can be spread easily to other bacteria. Antibiotic resistance should be prevented however possible. Antibacterial products are shown to reduce the spread of infection and are not supposed to make the bacteria more resistant. Antibacterial products include hand sanitizers, hand soap, hand wipes, etc., Dawn, Dial, Lysol, etc. Mycobacterium tuberculosis is multi-drug resistant, which makes it a very dangerous disease. It is difficult to get rid of because there isn't a known antibiotic that will get rid of the disease. These are dangerous because they keep multiplying until it takes over, and the fact that they can't be removed by an antibiotic.